Have you ever heard of a treatment for depression that uses magnets? It sounds like something out of a sci-fi movie, right? But it's very real, and it's called Transcranial Magnetic Stimulation, or TMS. Today, we're going to dive deep into what TMS is, how it works, who it can help, and what you can expect if you ever consider it. So, grab a comfy seat, and let's get into it. First things first, what exactly is TMS? Imagine your brain as a complex electrical network. Sometimes, in certain areas, the activity in this network can slow down, especially in people dealing with conditions like depression. TMS is a non-invasive procedure that uses magnetic fields to stimulate nerve cells in the brain to improve symptoms of depression. The key word here is non-invasive. There's no surgery, no anesthesia, and you're fully awake and alert the whole time. So, how does this magnetic magic actually work? During a TMS session, a small electromagnetic coil is placed against your scalp, usually near your forehead. This coil delivers a magnetic pulse that painlessly passes through your skull and stimulates nerve cells in a specific region of your brain called the prefrontal cortex. This area is heavily involved in mood regulation, and it's often underactive in people with depression. Think of it like a gentle jumpstart for your brain cells, encouraging them to become more active and communicate more effectively again. It's a bit like physiotherapy for your brain, helping to retrain and reactivate those important neural pathways. Now, you might be wondering, is this some new experimental thing? Not at all. TMS has been around for a while and was approved by the FDA in the United States back in 2008 as a treatment for major depressive disorder. Since then, its use has expanded, and it's also been approved for treating obsessive-compulsive disorder, or OCD, and for helping people quit smoking. Researchers are also exploring its potential for a bunch of other conditions like anxiety, PTSD, and even chronic pain. So, it's a well-established treatment with a solid track record of safety and effectiveness. Who is a good candidate for TMS? Typically, TMS is recommended for adults who have tried other depression treatments, like antidepressant medications and therapy, without getting the results they hoped for. This is often referred to as treatment-resistant depression. It's not usually the first thing a doctor will suggest. But it's a powerful option when other methods haven't provided enough relief. It's for those who feel stuck and are looking for a different approach to finally feel better. Of course, a thorough evaluation by a qualified doctor is essential to determine if TMS is the right fit for you. Let's walk through what a typical TMS treatment course looks like. It's not a one-and-done kind of thing. A standard course of TMS usually involves sessions 5 days a week for about 4 to 6 weeks. Each session is relatively short, lasting anywhere from 20 to 40 minutes. You'd go to a clinic or a doctor's office, sit in a comfortable chair, and the technician will place the coil on your head. During the treatment, you'll hear a series of clicking sounds and feel a tapping sensation on your scalp. It might feel a little strange at first, but most people get used to it very quickly. You can relax, listen to music, or even chat with the technician during the session. After it's over, you can just get up and go about your day. There's no recovery time needed, so you can drive yourself home or go back to work immediately. One of the biggest questions people have is about side effects. This is where TMS really shines compared to some other treatments. The most common side effects are mild and tend to go away after the first week or so. These can include a mild headache or some scalp discomfort where the coil was placed. Some people might experience some facial twitching during the pulse, but that's temporary. Serious side effects are very rare. There's a very small risk of seizures, but this is extremely uncommon, especially when all the safety guidelines are followed properly, compared to the systemic side effects that can come with medications. Many people find the side effect profile of TMS to be much more manageable. So, the million-dollar question, does it actually work? The answer for many people is a resounding yes. Numerous studies have shown that TMS can be highly effective. A significant percentage of people who undergo TMS experience a substantial reduction in their depression symptoms. Even better, a good number of them achieve full remission, meaning their symptoms go away completely. The effects can also be long-lasting. Of course, like any treatment, it doesn't work for everyone, but the success rates are very encouraging and offer a real beacon of hope for people who have struggled for a long time. Let's quickly touch on a few other things. What's the difference between TMS and something like ECT or electroconvulsive therapy? While both are forms of brain stimulation, they are very different. ECT involves a controlled seizure and requires general anesthesia. TMS, as we've discussed, doesn't cause a seizure and you're awake the whole time, making it a much less intensive procedure with fewer side effects. Is TMS covered by insurance? In many places, yes. As TMS has become a more mainstream treatment, more and more insurance companies are providing coverage for it, especially for treatment-resistant depression. It's always important to check with your specific insurance provider to understand your coverage, but it's definitely becoming more accessible financially. If you're watching this and you or someone you know is struggling with depression, please remember that there is always hope and help available. It's so important to talk to a doctor or a mental health professional to explore all your options. TMS is just one of many tools in the toolbox, but it's a powerful one that has changed a lot of lives. It represents a shift in how we understand and treat mental health, moving towards more targeted and personalized approaches. To wrap it all up, transcranial magnetic stimulation is a safe, non-invasive and effective treatment that uses magnetic pulses to reawaken parts of the brain affected by depression. It's a fantastic option for those who haven't found relief with traditional treatments. It requires a time commitment, but with minimal side effects and no downtime, it fits into daily life pretty easily. The science is solid, and the results speak for themselves. The future of mental health treatment is exciting, and TMS is a big part of that. Thank you so much for joining me today to learn about this fascinating topic. If you found this video helpful, please give it a thumbs up and consider subscribing for more content on health and wellness. And as always, take care of yourselves and each other. See you in the next video.